We've got an ageing population. I think that the incentives to work in the NHS are not the same as they were. So the challenges from an older workforce population around lifetime allowance, pension allowances, opportunities to develop, I think those have changed significantly over the last few years, and we're seeing a significant increase in the number of our very experienced, more mature staff leaving the organisation because of those things outside of our control. I think if we're going to recruit the new generation to come and work in the health service, we have got to be much more focused on digital technology. It's how people live their lives today. I think I gave an example of my son using health services and asking the question, well, why do I have to go and see the GP? Why can't I just take a photograph of my sore throat and send it to him and then he can diagnose? Now, that was a question 2 or 3 years ago, which wasn't available. It is available now. We've used it. It's absolutely superb. We can go online, speak to somebody, have a diagnosis, pick up your medication from the chemist, and all of that can take 10 or 15 minutes. You've not driven anywhere. You've done it from the comfort of your own home. I think that that's the way that we will move for the future. People will expect that sort of treatment. You know, we work and live in a world now that is instant gratification. People don't want to wait for things. They want the world to change in step with them. And I can see that happening. So we do Skype appointments for some categories of patients. We do virtual fracture clinic appointments now, so patients don't have to come in. That is evaluating really well, even in some of the older population who aren't used to dealing with technology in the same way that our younger generation is. So I think that this will move faster and faster and faster. We have the challenge of not only keeping up with it, but not stifling it. You know, our own mindset, our own experiences will shape how we approach the future. It's up to people like me to get out of the way. If I can't, help support the drive for a technological revolution. The health service, despite the level of technology we achieve in the long term, will never not need people. You know, it is a people business. And so I think we have to find different ways. It's a huge resource, an expensive resource to use in the way we are. We should be looking at how do we use social care, community care, you know, other technologies to look after those people who need something at a point in time but don't need an expensive visit to see a really scarce resource.